eligible for the vaccine. And like I said, it's 2 shots over 6 months. Getting these 2 shots will build up the antibodies in your body to a level where you can fight it off if you ever come in contact with the real virus. So that's the deal with the vaccines. Now, when we talk about prevention, I would say the best way to prevent from getting hepatitis A is to get these 2 shots. This is the best way to prevent it. Outside of that, I would say wash your hands thoroughly, especially before you eat or before you put anything to your mouth. Be careful who you share with, because this stuff is passed from person to person really, really simply. So when I say washing your hands thoroughly, I mean with warm water and soap for around 20 seconds. You can sing the ABCs or go through the alphabet in your mind real quick, and that's a proper amount of time to wash your hands. Get in between your fingers real good, rinse with warm water, and that'll help protect you against the hepatitis A virus. And then, like I said, be careful who you share with, because you never know who might be, infected with hepatitis A. So when it comes to testing, like we talked about a few minutes ago, it's really important that you get tested, because that's the only way that you find out for sure that you have hepatitis. You guys follow me on that? Mm-hmm. All right, you got any questions about hepatitis A? All right, let's move on to B. Hepatitis B is a microscopic virus that causes inflammation of the liver. And like hepatitis A, hepatitis B can be acute. And around 85% of the people who get hepatitis B, they develop an acute illness and they pass it within 2 weeks to 6 months. They pass it. But a small percentage, around 15% of adults who get hepatitis B, develop what we call a chronic illness. How many of you guys know what chronic means?
Persistent?
Yeah, persistent. That's kind of a good look at it.
Hardcore?
Yeah. Well, in this case, chronic simply means long-term. Acute means short-term. Chronic simply means long-term. So around 15% of people or adults that get hepatitis B develop what we call a chronic illness. It lasts longer than 6 months. And a chronic illness can be serious, because anything that stays with your body for a long time has more opportunities to do damage to your body. And in this case, chronic hepatitis B can do these kind of things to your liver. Like I showed you earlier, this is a healthy liver, blood flows through it really easy, it does its job. But when your liver, when you get chronic hepatitis B, what can happen is you can develop fibrosis of the liver, cirrhosis of the liver, liver cancer, and liver cancer can be fatal. So chronic hepatitis B can be fatal. So I want you guys to remember that. All right, so 15% chronic, 85% acute when it comes to hepatitis B. 3 things, like hepatitis A, 3 things got to happen in order for you to get hepatitis B. First thing is you got to be exposed to somebody who has it. The second thing is there has to be an effective method of transmission. And the third thing is there has to be enough of the hepatitis B virus in the body fluids. With hepatitis A, the body fluid was feces, and hepatitis B, the body fluids are semen, vaginal fluids, blood, breast milk. Now I want to talk about breast milk real quick, because this is important. I want you guys to remember this. We know that the hepatitis B virus is found in breast milk, but no conclusive studies have shown that a pregnant mother passes the hepatitis B virus to the baby through breastfeeding. So a pregnant mother could have hepatitis B, but there's no conclusive studies to show that she actually passes it to the baby through her breast milk. Follow me on that?
Yeah.
So that's important. But I also want you guys to know that a pregnant mother can pass hepatitis B to the baby through the birth process. So if they know that a mother has hepatitis B, what they do is within 12 hours after the baby is born, they give the baby a shot of this stuff called immunoglobulin. And what immunoglobulin does is it helps boost the baby's immune system to fight off the virus. So that's the deal with pregnant mothers, breast milk, and babies. So let's go back to semen and vaginal fluids. When I say semen and vaginal fluids, what's the first thing that pops to your mind?
Sex.
Sex. Unprotected sex is the most common way that hepatitis B is passed from person to person. Unprotected sex. And so normally when we think about something that we could get from unprotected sex, we think about stuff like HIV, gonorrhea, syphilis, that kind of stuff. Herpes, exactly. The sexually transmitted infections that we hear about a lot. But hepatitis B is a sexually transmitted virus. And so you can get it through unprotected sex, and this is the most common way that hepatitis B is passed from person to person. So here's how this happens. If I had hepatitis B and I'm having unprotected sex with baby girl, and some of my semen gets inside of her, that exposes her to my hepatitis B. Why? Because we know that this virus is found in semen, and if I was infected with hepatitis B and some of my semen gets inside her, that puts her at risk for getting my hepatitis B. Vice versa. If I'm having unprotected sex with baby girl and she has hepatitis B and some of her vaginal fluids get inside that hole in the end of my penis, we all have one. It's called the meatus. Some of these vaginal fluids get up inside there. That puts me at risk for contracting her hepatitis B virus through unprotected sex. So unprotected sex puts us at risk for contracting hepatitis B. Now let's talk about blood for a second. If I had hepatitis B, how's my blood going to get from me to you?
Tattoo needles.
Sharing tattoo needles. That's good. Sharing is the key word here, because I could use my own tattoo needle all day long. But the minute that I share it with somebody else, if I had hepatitis B, the minute that I share my needle or my ink or my barrel with somebody else, that puts them at risk for contracting my hepatitis B. So I'm going to put TAT equipment up here. And when I talk about TAT equipment, I'm simply referring to the ink, the needle, and the barrel. These are all things that are exposed to blood during the tattooing process. Now, what else? How else can my blood get from me to you?
Syringes.
Syringes. I'm glad you said that. I'm going to put needles up here. And everything that's involved in the shooting up process could potentially be infected with the hepatitis B virus. I'm going to go through this real quick. Now just imagine I have hepatitis B. And I'm fixing to get loaded. This is my outfit. And I slam some dope with this. Woo. I get my issue. When I take this out of my arm, what's going to be on the end of this needle?
Blood.
Blood. Exactly. Now, if this blood is infected with the hepatitis B virus, and I let you use this outfit after me, even after you put bleach in it, some type of disinfectant, not guaranteed to kill the virus, and you use this outfit after me, and you take it and stick it right into your arm like this, they call that direct entry. The virus that's on the end of this needle could potentially go into your bloodstream and put you at a really high risk for contracting my hepatitis B virus just from sharing the needles. So sharing outfits, sharing the cooker, the cotton, the water, everything that's involved in the shooting up process could put you at risk for contracting hepatitis B, because all this stuff can be tainted with blood. Also, razors put us at risk. Sharing razors, sharing tutors that you snort drugs with, tutors put us at risk, and also toothbrushes. They put us at risk also. So I'm going to write this up here. Let's see. Needles, cookers, cotton, tutors, razors, toothbrushes. All these things could be exposed to blood, potentially have blood on them, and put us at risk for contracting hepatitis B. So these are some of the behaviors that expose us to these body fluids that could potentially have this virus in it. So these behaviors, these are what we call risky behaviors that put us at risk for contracting this virus. So when we talk about symptoms, same thing as hepatitis A. There are symptoms associated with hepatitis B, but these symptoms are associated to other illnesses as well, flu-like symptoms. And so the main thing that I want you guys to remember about the symptoms is if you feel sick, to go see the doctor and have him test you and find out what's going on with you, because that's the only way that you can truly tell if you have hepatitis B. When it comes to treatment, there is no specific treatment for acute hepatitis B because people pass it within 2 weeks to 6 months. But with chronic, for the small percentage, about 15%, that develop a chronic illness from hepatitis B, there is treatment available. But again, got to see your doctor and got to find out what treatment is best for you. When it comes to vaccines, there is a vaccine for hepatitis B, and it's 3 shots over 6 months. And it's important that you get all 3 shots to be fully protected. Again, treatment and vaccine are different things. Treatment is, after you already have the virus, and vaccines are to prevent you from getting the virus to begin with. And so, it's important that you get all 3 shots, and these things will boost up your immune system and protect you from the hepatitis B virus. Prevention, I would say the best way to prevent hepatitis B, like hepatitis A, is to get this vaccine. Get these 3 shots. If you've never been exposed to it, then you can get these shots, and these shots are the best way to prevent from getting hepatitis B. Outside of that, I would say stay away from these body fluids of other people. And what do I mean by that? That means stay away from these kind of behaviors that put us at risk. If you have sex, protect yourself. Wear a condom. Create some kind of barrier between you and another person's body fluids. When it comes to tattoo equipment, I'm not suggesting that you get a tattoo, but if you did, inside here, and use your own ink, use your own needle, use your own barrel. Don't share with anybody, because we know that